And this is just a quick little snap of my lesson plan on our Angel homepage. Okay. Now, this is the part where the students are doing their online reading in the lab, in the computer lab. They've had an internet article assigned to them, and they're looking it up ahead of time and reading and researching so they're familiar with our topic of constipation management as we work through our lesson. The article is a very good algorithm and expands on the material that's not covered in their textbook. I would like you guys to answer the following question. Please stand up if you are the person that is lucky enough never to have been constipated in your life. If you've never been constipated once in your life, would you please stand up? Oh, gee, no one is standing up in our class. It must be that everybody's had constipation problems at some point in their life. Let's try another question and everybody stand up. Who would like to improve their nursing practice today? Okay, now everybody's standing up. Thank you. Standing up. What? No, I'm standing up. There we go. Now everybody's standing up. Okay. Thank you very much. That's enough. You get the stop button on now. Okay. In your hands, and this is just for reference, for refreshing how talking chips work. We put our chips in the basket after we share our thoughts. So I'll go ahead and I'll lead off with just a little thought. Fears, anxieties, excitements about managing constipation. I get excited about managing constipation because I can bring relief to my elderly patients, and I like to see their smile when they're relieved. Okay, that's my talking chip. Anybody got a fear?
I have a
Thought?
fear.
Okay.
I'm sort of fearful about dealing with people with constipation if you have to use your finger to help them out.
That's mine.
Okay, well we'll take a couple more chips on that one.
That's my thing, is sticking your finger up your butt.
Exactly. We don't want to hurt them when we manually disimpact, is what we call it. We'll stick their finger up there, and that's absolutely correct. That's a really common good fear. Okay, I think we'll be able to address that today. Brandy.
I'll say that I'm excited about learning about constipation because as well, they probably don't bring it up, and now I can bring it up to them to be able to help them feel not so insecure about it.
Wonderful. Great patient teaching aid. Thank you, Brandy.
I'm scared that I'll be the one nurse that either gets them too constipated or gets them too, like, one way or the other and sending them off to the hospital.
I'm right there with you.
Okay. You guys are afraid that you're not going to get it quite right.
Right.
There's so many different combinations you can use.
That's right. There's so many combinations, and we'll address that in class today too.
I'm scared about giving
Okay,
enemas.
Felicia? Okay, what did you guys say then?
I said I'm scared about giving enemas and having them go all over me.
Scared the enema's going to go all over her. Okay, you're scared the
I'm
enemas too?
scared of giving an enema, yeah.
Hey, that's really reasonable. Here's my students logging in to take their pre-quiz on Angel. Here they're waving because they're happy. They're going to log in and take their pre-quiz on Angel. Oh, absolutely, have at it, yeah. Now here's our students doing a little bit of independent study on their own, just reviewing their constipation management protocols, printing off some handouts, and getting ready for the next phase of our lesson. Just kind of handling things as they see fit for the next 15 to 20 minutes. And then we'll reconvene for watch our movie and continue with our lesson.
Is your my mom
More active student-directed learning in the computer lab.
What you'd be saying back to me is that you do go regularly to the toilet every day. If you don't do that, then let me offer you a few tips and let me sort of give you a few sort of suggestions. As a busy executive, it could be that you don't get so much exercise. Number one, if you can increase your exercise, that would be a great way to crack a bit of constipation. Why is that? Well, your main GI tract, gastrointestinal tract, in which you process your food and then convert it into feces and then sort of push it away.
A very brief overview lecture, and it is you have a written supplement with you, and I want you to take some notes on that, and I want you to go ahead and ask questions. And basically, I'm going to elaborate on this lecture and follow the outline that you have with you, but I don't want to tell you everything. So this is our short lecture on managing constipation. So far we've done our pre-quiz, and we've done our movie, and we've done our required reading ahead of time, so hopefully we're getting an idea about managing constipation. At this point we're going to just elaborate on those concepts. So, managing constipation, wrote this lecture myself. This is the definition of constipation right out of the tables. It is the presence of hard or infrequent stools that are difficult or painful to pass. That is constipation. There's no time frame on it. It's just hard or infrequent stools that are difficult to pass. And as we know from our stand-up, sit-down exercise, every one of us has had this experience at some point in time, and it's not pleasant. And so therefore we want to be good nurses and help patients avoid that experience of constipation, which is why we're doing it. We get out our, this is our rectal suppository, and I'm going to go ahead and set up over here. And yeah, these are all rectal suppositories. Now in real people that are not mannequins, we lubricate, right? We've got our KY on there. Okay, so we've got our patient turned over, and you're looking at skin. This is a great time to look for those hemorrhoids and those skin tags. When your patient's all nice and turned over, I get myself a little closer to my patient, like this, and then I warn them that I'm coming. You'll feel me touching, is what I say. Okay, now you're going to feel me touching, and then I lift up a little bit, and here's my anus. Okay, I put my lubricant out here. At this point, I warn them. It's going to be a little cold. That's just the lubricant, and you feel my finger touching. Warn them that their fingers come in there. Okay, now would you take a deep breath for me, because I've got to slip my finger inside here, and then this person has a very tight sphincter. Normally they relax and you can get your finger in here, but this person is not letting me do that. So take a deep breath now, relax. Okay, now the person has taken a deep breath, relaxed, and I've gone past the external and the internal sphincter into what we call the rectal vault. And that's where we start to examine for stool. There's literally a little vault in there, and that's, we literally put our finger in there and feel what we can feel. And that is what is going to determine the rest of our plan of care. If the vault is empty, then we start working from the top. If the vault has got something in it, then we're thinking suppository or enema. Cows come home, they got no way to push, so you got to go ahead and do a little bit of digital stimulation. And again, back to our model, of course I would be gloved up and my finger would be inserted into the rectum correctly. But what digital stimulation means is I'm past those internal sphincters and I'm literally stimulating that bowel. The most important management tool of all is your skilled brain. Isn't that nice? Now, next I have a little exercise that's designed to help you develop your skills, and that's called case studies and problem solving. It is 6 o'clock, and we may want to consider a short presentation. Now, this is the part where the students are working on their group case study and using the bowel management algorithm to develop and implement their plans of care for their individual patients. Here's Ashley and Carissa. Wave now. All right, here's Emily, looking good. Kristen, Rachel, you're looking good. Okay. So this is another clip over here of the students. They're working on their case studies at this point. We've been through our lecture, and they are developing their individualized plans of care to manage their patients' bowel problems. Here's another group of students working on their plans of care together. Okay, and the louder the room gets, the happier I am, because we have engaged students in active learning at this point. There's some more students engaged and active. What kind of stuff would Metamucil be?
It's here under fiber.
It would be under fiber. That's a fiber product that you want to give the water so you're building bulk. The milk of magnesia, again, would be the osmotic laxative that's pulling the water out of the system. So more water wouldn't hurt with the milk of magnesia. But the fiber is what we want to give the water with. Okay?
So you want to do the fiber before Dawson Senna?
You would give the fiber before the Dawson Senna. Depends upon the patient. A real young ambulatory patient that's really drinking things well and moving, fiber might be a really good choice before Dawson Senna. Kind of depends. In your older population, probably Dawson Senna. Yeah, okay. So now we're at the point in our project where the students have completed their case study, and we're going to do a little stand-up report, and one of our student teams has volunteered to actually be taped in giving their stand-up report to the class.
G is an 82-year-old male you see at home to manage his advanced lung cancer. He takes morphine sulfate ER 30 mg 3 times a day and uses morphine sulfate 15 mg every 1 to 2 hours for breakthrough pain. He's already taking DOS 200 milligrams twice a day and Senna 2 tabs 3 times a day. His last bowel movement was 5 days ago. He reports a decreased appetite and a feeling of fullness in his lower bowel. His bowel tones are normal in all 4 quadrants, and the rectal vault is empty. You can feel a rather large mass formed stool in the colon just beyond reach of your finger. The patient requests some help to get started with his bowel movements. Please intervene. And we figured since the vault is empty, you said you start from the mouth. So he's already getting DOS and Senna, so we figured the next thing would be maybe some Miralax, right? Mm-hmm. And if that didn't work, move down the chain, Vocamag, and then if that still doesn't work, then pull out the big guns and do the sorbitol or lactulose.
Okay.
And I encourage fluids.
Yeah, because it's not an emergency because he's got normal bowel tones and all that good stuff. So I mean, it's not like there's no obstruction right now. So. And then encourage him to fluids and regular fiber. Go over what he should be eating,
Okay.
that kind of thing.
All right.
And that's about it.
Well, I'm just going to survey the class really quickly here now that we've wrapped up our case studies and make sure that we don't have any muddy points left. Anything that's confusing for you at all? As we survey the class, are we all solid here? Okay, well I think now that we're clear that we don't have any muddy points at this, do you feel like you've learned a little something so far?
Oh, yes.
Okay. We're going to go ahead and we're going to do the last piece of our in-class lesson now, and that is going to be, we're going to review our enema administration module on the ATI homepage. We're going to watch a video on enemas and then clarify for any muddy points around enema administration, because I know there were some fears voiced about that early on. And so we'll clarify on that, and then we'll go ahead and we'll take our constipation post-quiz, and that will wrap up the theory component of our lesson on managing constipation in the elderly. So let's go ahead and boot up to the ATI and watch our enema module. And here's where we boot up to the ATI homepage and go to the enema module skills. Let's just go here to My eLearning on ATI. This is a program that the students use ongoing. And then we'll go down here to our nursing skills modules and do a little screenshot of that. And now we're going to go right down here to our enema module. And we're going to open that up. Here's enema.
Leave them in the Sims position after enema.
Would it be easier to leave them in the Sims position after administering the enema to help them hold the enema? Is that your question? That's your muddy point? Okay, actually they're not quite as tightly constricted. They're not going to hold it quite as well. If the patient can tolerate it, absolutely. But if they're not tolerating things well, it could be okay that you could turn them over on their back and they may be able to retain that fluid a little bit better than being in the Sims position, just because you want them to tighten their sphincter up as best they can.
It just seemed like to me that changing of position might let it all come out.
And it might, you're right. So it's back to an individualized thing. Yeah, you got to assess your patient and what they can tolerate and what they can do. Yeah, and that's an excellent point. Thank you, Sarah, for sharing that. I appreciate
I
that.
saw that happen at the hospital one time. Why would you use molasses?
Oh, that's an interesting question. Emily's asking, why would you use molasses?
Like baby's Caro syrup.
Yeah.
Where they tell you to do that when you're
Yeah.
pregnant and you want to get induced
Like if
yourself.
if your baby's constipated, they say to put Caro syrup in the bottle, kind of the same.
Okay.
Is Caro syrup like corn syrup?
What would be the rationale for that?
It's like the syrup, the one sugar.
Sorbitol.
That. Lactose.
Exactly. Yeah, it's sugar. Okay.
It's not lactose.
So, baby drinks corn syrup. Give the patient molasses enema. It's the sugar. It's the sugar that you're putting in there, and it's osmosis. Thank you for bringing that up, Emily. That's a good point. We used to give molasses enemas quite a bit.
I got 100%. Yeah.
I got 100% too.
Good. Do you think you learned something? This is our students taking their post-quiz after our lesson. Getting 100% on their post-quiz. They learned something. Yay, you got 100. Okay.